The purpose of this study was to examine how cultural changes that adolescents experience after they immigrate to the United States, how those changes impact their health behaviors later on. It was a longitudinal study following adolescents to see how their beginning cultural experiences actually impact their health behaviors later in their adolescent development. Well, there were really two very important findings that we were able to underscore. The first thing is that adolescents' sense of their ethnic identity, which is what we call their rootedness in their Latino culture, for example, how much they continue to practice their cultural beliefs and norms and behaviors that they bring with them. That sense of ethnic identity is an important protective factor for them. When we say protective factor, we mean that it sort of shields them against the stress that they experience during these cultural changes. And because that stress has less impact on them, then they end up making healthier choices. There were findings related to the parents in the opposite direction. Parents tend to come over after immigration and they hold very tightly to their ethnic identities, their cultural experiences that they have ingrained. And so our findings underscore that it's important for parents to be able to expand their cultural behaviors to integrate some of the new aspects of American or U.S. culture, if you will, the new cultural experiences they're having. To the extent that they're able to do that, their adolescents, in our study, their adolescents showed less anxiety, less aggressive behavior, and less depression 1 year later. And so it was very beneficial for the adolescents, for their parents, to be able to become more bicultural, being able to balance between both cultural systems. We don't want them to lose their identity from their Latino cultures that they bring with them, because that's very important. So both adolescents and parents were trying to focus on being more bicultural, and that was the most healthy in terms of predicting their behaviors later on. As adolescents and their parents become more bicultural, they tend to make healthier choices because they have the capacity to navigate between the two cultural experiences and integrate aspects of both their Latino and the U.S. culture that allow them to access resources from both systems, have more support, social support from both systems, and be able to make choices based on beliefs and norms from both systems. And so, as you can see, having that wider repertoire of choices allows them to make decisions for their health that are healthier in the long term. The findings suggest prevention programs that would be focused on two things. One, on trying to lower the acculturation stress. And when I say acculturation stress, I mean the difficulties in having to balance between two cultural systems. The stress that happens from discrimination or from having to learn English very quickly, and from not knowing how to behave in a new cultural system. So preventative programs should focus on trying to give both parents and adolescents skills on how to manage those cultural changes, number one. Number two is we want to be able to increase their levels of biculturalism in both the adolescent and the parent. And what that means is that adolescents who quickly tend to soak up the new cultural experiences, we don't want them to forget their roots. We don't want them to speed away from who they are and who their parents keep saying in terms of integrating their ethnic pride, because that's an important factor that lowers that stress. Secondarily, with the parents, we do want them to begin to reach out, to be able to navigate the system, to be able to feel comfortable talking to teachers, because that is an important factor in helping their adolescents adjust and have smoother social relations and have less risk-taking behavior.